A group responsible for coming up with a plan to reduce the abuse of painkillers in Tennessee has turned in its final reports.
It's called the Opioid Abuse Reduction Act Working Group's 265-page report, and includes several recommendations all about helping Tennessee fight this huge problem, a problem community watchdog Nate Morabito told us about back in November. It is the leading cause of overdose deaths in the Tri-Cities, and Nate found out in an update a local doctor helped to shape the report.
That's right. Frontier Health's Dr. Randall Jesse took part in this effort. He says Tennessee is on the right path, but still has a long way to go. Our data analysis previously concluded 580 Northeast Tennesseans died from drug overdoses in just a 5-year period, most of them from opioids.
It's too painful.
We've heard concerns about opioid abuse from parents.
We're losing productive people in our society.
Toxicologists.
It's not good for Tennessee to be seen in that light, especially Northeast Tennessee.
Lawmakers.
How do we increase prevention resources? How do we look at expanding treatment resources?
And just last week, the nation's drug czar at a White House forum in Knoxville. In recent months, a group of experts in Tennessee outlined ways the state can do more to fight painkiller abuse. The Opioid Abuse Reduction Group's report includes 4 recommendations. Most notably, the group wants lawmakers to extend the state's controlled substance monitoring database. That database requires healthcare workers to review a person's substance abuse history before prescribing certain drugs.
I think we've made great progress, but it's such a huge thing.
Dr. Randall Jesse says the recommendations are a good continuation of the state and its leaders' efforts so far.
You've got champions out there. So Tennessee is in good shape with champions right now. What we're not in good shape with is funding, dollars.
He says many of the patients Frontier Health treats need up to a year of counseling.
I'm talking about full behavioral health addiction treatment that you get that deals with the person.
Treatment, Dr. Jesse says, is not cheap. As a member of the Opioid Abuse Reduction Group, he's asking the state and federal government to put more of a focus on a long-term fix.
What I'd like to see is funding for longer-term treatment. Right now, we have the ability to treat people, but it's very short-term.
And Nate, I understand you talked to one of the lawmakers who helped to create the task force, a lawmaker who's also a pain management doctor in Nashville, right?
Knows a thing or two about this, right? Senator Steve Dickerson continues to push for more access to what are called tamper-proof medications. Basically, they are more expensive, but they're made to prevent drug abuse. So, for example, you couldn't crush a pill and then snort it. You have to take it the proper way, the way the doctor prescribed it originally. Like Dr. Jesse, he also said there's a need for more funding. Plus, he says there's really a need statewide for more mental health professionals to help this specific group of patients.
Huge issue in the state. Nate, thank you very much. Sarah?